Welcome to Beyond the Scale, Weight Loss and Wellness. I'm your host, Coach Monica. I'm joined today by Coach Darcy, and we are here to guide you through the ins and outs of a lifestyle that's transformed not just our lives, but the lives of countless women navigating the waves of perimenopause and menopause. Whether you're here to shed weight, understand your body better, or simply find a community that gets it, you're in the right place. So sit back and enjoy the next few minutes as we tackle the hot issues of today. Good morning. Good morning. Good morning. How are you, Coach?
I am doing fantastic. It is a not sunny day, but it's a great day to be alive.
Beautiful day. Yeah, it's beautiful day. It's especially beautiful today because our internet is working.
It is. By the grace of God, I prayed. I'm like, Lord, you're in charge.
Lord, you know who needs to hear the message we're giving today. Please get it to exactly who it's supposed to go to. That's what we pray every time that we come online with everybody. Because
and apparently when we don't, that's when we don't get good internet.
So send us a DM right before we go live and just say, did you pray that God would get your message out? So that's what needs to happen. How are you doing today, Coach? Are you having a good day so far? A good week so far?
Yeah. The early mornings are starting to hit me from school. Like it's like a gradual, you've got the August and then September, like now we're ending at the end of September and starting to hit me of waking up at 5:45.
Well, the
morning.
The time change and all of that.
That hasn't happened yet, has it? Our time change?
I think it's October, right? Where we fall back?
So it's soon, yeah. So it's gonna mess me up even more, so please give me grace.
Yeah.
As I'm, like, dozing in my chair.
Yeah.
But it was a good reminder from Dr. Barry the other day of getting your supplementation of D3 and K2.
D3, yeah. I started taking that again.
Yeah, it's
Put
that time.
in my list of pills that I take every morning to keep myself healthy. And yeah, it's been a crazy couple of weeks. America has been in mourning and is mourning the loss of an incredible beacon of free speech. And I tell you what, I was wrecked on Sunday as I watched the memorial of Charlie Kirk. I was just, I headache cried. Like I started watching it, I think when you did at 1:00.
Yeah.
And the worship, it was a big revival. And I cried until I had a headache. And I thought I was done crying. And then Erica Kirk got up there. And I cried till I had a horrible headache.
Yeah.
The loss of her husband, and all of us felt like we had never met him before. I'd seen him. He came and spoke at one of our events one time, but I never got to meet him in person. And we just felt like he was us and he is us. And so, yeah, it was a sad week. And yet I remember the time that my heart turned from anger, pure anger, to excitement. I don't know if people know this, but he gave us MAHA. He gave us Make America Healthy Again, because not only did he lose 55 pounds and realize the need that if he was going to do what God called him to do, that he better get healthy, but he gave us RFK. And he gave us this chance that we are literally watching. We watched a news conference yesterday of our leaders digging in and finally asking the question, why do we have autism? Why? Yeah. And in the big news conference yesterday, we're going to talk a little bit more in the show about that, but it was intense. But we have that because it was Charlie Kirk who introduced and who said, hey, President Trump, this is who you need to bring. This is the group of people that you're missing in this administration, the MAHA people. I remember when I went to RFK's hearing when he was confirmed, I stood in line with people of all political backgrounds. I didn't know it at the time, but as I was standing in line, I'm standing next to a Democrat. I'm standing next to a libertarian. All of these people in one line who all agreed. It was the coolest thing ever. I had a ball standing in line, getting to know these people. And in fact, yesterday I was going through a kind of a downtime yesterday where it's just, I don't know, there was just a heaviness. And I got a text we had created, I was standing in line, for his confirmation, and we had created this text message called Healthy Ladies. It was the ladies that I was standing around, and I just randomly got a text from some of those ladies who said, "This is our moment. This is why we were standing in line at 4 o'clock in the morning in the cold. This is why. I want to encourage every one of you ladies to stand up and use your voice." And so we reconnected after, I don't know when he was confirmed, but it was just the coolest thing. And I was able to tell them how discouraged I was after watching women drink a bottle of Tylenol yesterday in protest of this finding. I was just like, God, help us. We got a timely message from these ladies that this is why we do what we do.
Yeah.
This is why you and I get up every morning and sit with women and sit with men and help them find the root cause of their disease. This is why we do what we do. And so I was inspired. It gets tiring when you are on the front lines of something that is not popular in the everyday world. It gets tiring and you begin to question yourself. Are we in this for the right reasons? And are we in this? Are we making a difference? And we're going to talk about today about taking health into your own hands. We have sick care. We do not have health care in America. We have sick care. And sick care is defined as treating the disease after it starts. And that's what we're going to talk about today. We're going to talk about removing yourself from this sick care world that we live in. And always a disclaimer, we're going to talk about the evils of healthcare today. But as always, we have to disclaim that there are good doctors out there who have just been listening to the wrong people. They get in this line of work, and I truly believe that most everyone gets into this line of work and wanting to help people. But when they get into the system, they are brainwashed and they are led by big pharma, who has to keep the cash cow fed. And right now, the cash cow is in threat. The cash cow is kind of starving because, and this is the coolest thing. I saw this. I followed this doctor, and I wish I remembered her name so I could promote her. But she's this amazing woman. She said, she posted 2 days ago. She said, doctors are getting angry right now. They're getting angry, they're getting anxious, and they're getting upset because for the first time in their practice, they have patients coming in and not buying their sick care and demanding that we get to the root of the cause. And now they're having to learn how to heal the root cause. And I want to start out the program. And that's awesome. And we see clients who come to us frustrated that the doctor only will test the TSH in their thyroid. Thyroid is the number one reason why we struggle losing weight. And doctors saying, I'm in charge. You don't ask me for the labs. I tell you what to get. Well, here's the cool thing about KM Health Coaching. We now have access to labs. We can now assign and prescribe labs so you can get your own testing done. You don't have to wait for your doctor. You can get your own testing done. Well, that happened. It ticked a doctor off this week. And she was like, well, I guess I can give these to you. I guess we can prescribe these. So here is, I want to read out of this amazing book, Dr. Barry and Kim Howerton. We love you so much. This book is incredible. Get it in your hands if you are frustrated. But what preventative care should look like. Let me read this. Although an increasing number of medical professionals promote preventative care, there is still a huge problem with the specialization separates physiology into siloed fields. When we divide the whole into, it's easy to forget that we are one organism in which everything is connected. Also, even when we do engage in what's called preventative medicine and the standard of care, which is the approved guidelines of treatment for a condition within each field, the point at which many diseases are diagnosed happens long after the optimal time to intervene has been left in the dust. So what he's saying is, we lost medicine when we went to specialized care because everything in our body is connected. And until we connect those things again, we will get sickcare. So, Darcy, that's a long introduction. We want to talk today about how to take your health back. We want to talk about that. Do you want to? I'm going to give you this job. So you're going to need your notes for this. I want you to break down. And we both did our own separate research. It was really cool. I was like, when you asked Siri and when we started to do all of these things, our numbers matched. So would you break down for us the metabolic crisis in real numbers? We have a crisis. Right. Okay. Yes. And then also don't forget in that the children's statistics, because those disgust me. Okay.
So we're talking about obesity, diabetes, metabolic syndrome, fatty liver disease. Those are the top ones that we're going to talk about. So obesity, we're going to talk percentage. And then I believe I looked up, we were actually in my household, we were curious about this number of like, okay, what is it for Americans? And I mean, I'm considered like, I'm still in the obesity category. So I'm not sure what they consider like, it's not morbidly obese. So about 1 in 3 people in America are obese, but there's 40.3 adults percentage that is obese, but then severe is 9.4. Did we say if we agreed with that or not?
Yes. Well, I think these were as far as 2023. So multiply, you've got 2 years of we don't have the statistics yet.
Yeah. So mine was more of I believe that mine was a recent 1 in 3 persons. That's still a lot.
That's huge. That's a big deal.
Yeah, no pun intended. Yeah. Diabetes, diagnosed plus undiagnosed is 15.8% of adults. Oh, wait, let me go back real quick. Because since we were talking about obesity, because I was like, okay, what is that in our children? Mm-hmm. And the childhood obesity, oh my goodness, this one is heartbreaking. It's heartbreaking. Between 19.7% of U.S. children and adolescents ages 2 through 19 have obesity. And then, so breaking that down even, ages 2 to 5, 12.7%. And you guys can look at this up on the CDC. Mm-hmm. There you go. This is legit. Ages 6 through 11, 20.7%. And then ages 12 through 19 is 22.2%.
That's our fault. That's our fault as mothers and parents.
Yes. We buy the food. Yeah. That's what we do.
As harsh as that sounds, diabetes, we cause that for our children.
Yes.
And there's no excuse for that. Right. No excuse.
It's not, I mean, people can bring up genetics all they want. But I feel like we shouldn't bring up genetics.
No, we need to open the refrigerator and open our cupboards. And that is exactly why we have 19% of our children ages 2 to 19 obese. Yeah. I remember when I was in school, there was one girl who had a weight problem, an obese, a massive, like she was very, very obese. And the percentage of my schoolmates who were chubby, there was 2 or 3.
Right.
And that was in 1980.
Okay.
Yeah.
Well, we're going to then go to severe obesity in children. Severe between 2 and 19 years is 7.0%. And let's see, it says most recent, and then up from 3.6%.
That's insane.
Wow. Diabetes in children and youth, 300,000, about approximately. I'm sure that's grown
352,000.
Yep.
Under 20.
Have type 2 diabetes. This is what our grandparents used to get. Like when I was, growing up, like that was the only thing that was heard of. Type 2 diabetes was with my grandparents. I don't know.
It's reversible and it's preventable.
Yeah. That's about 35% of persons under 20. Type 1 is still majority in youth, but type 2 diabetes in children is increasing. It's increasing, and it's going to continue to increase until we figure out and we let RFK and our health cabinet does what they need to do.
Until we say the hard things out loud.
Yeah.
What we're saying today is very harsh. It is very harsh. For me to sit here and say it's the parents' responsibility that these numbers are the way they are, that's not very popular
Yeah.
because we live in a feelings-oriented world, and it's hard to parent. I mean, you say amen to this. It's hard to parent
Yeah.
in this world when ultra-processed food is thrown at our kids.
Mhm.
It's hard.
You know, I work with youth and I see what they bring into schools. I see what they're drinking every day. And, you know, they're drinking these Starbucks drinks, they're drinking these monster drinks. Not only is this not great for their heart
Mhm.
with the energy drinks that they're bringing into town, and drinking not just one, but up to 5 a day. This
Yeah.
is legit.
Yeah.
This is my own data that I've collected with the teens that I just know around me. I can only imagine what it is like out
Yeah.
beyond my eye view
Yeah.
of the teenagers. So, but the Starbucks drinks, like every single day, they've got these dark coffee drinks, these full of sugar.
Yeah.
Side note, okay, so I digress. So diabetes for adults was the 15.8%. Metabolic syndrome, you've got 40 to 42% in adults, 54% age 60 or older.
Metabolic syndrome is the things like PCOS.
Yeah.
It's like those things that, that can be reversed,
Yes.
but we blame it on genetics.
Genetics,
40 40
age,
percent
age.
Age?
Yeah,
No. Fatty liver
yeah,
disease.
yeah. So fatty liver disease is 30 to 40% adults. 30 to 40% adults. And when somebody's diagnosed with any of these, I can just imagine them going to the doctor and the doctors are like, "Oh,
Yep.
you're pre-diabetic or you're
Yep. Here's a pill.
you've got fatty liver disease or your feelings are probably in panic and
Mhm.
whatever is happening, you're like, "Well, how did I even get here?"
Right.
Oh, and then you ask the doctor and he's like, "Oh, no worries. We've got a Band-Aid for you."
Yeah, here's a pill for your symptom. Like,
So, just when you are going to the doctor, I think my side note is, before you go into the next, or am I doing
yeah,
that?
no, I was just gonna compare it to global. What is
Okay.
it global? Because here's the thing. America is richer. We are more educated than anybody in the world, but we are the sickest.
Mhm.
Why is that? My
That's what I was just about to say was, like,
money.
ask yourself
Yeah.
why.
Why? Why are we sicker? 16% is global obesity. We're 40, and that was in 2023. Global diabetes is 11%. Why are we sicker? And I just take it back to the cash cow. And somebody correct me if there's another reason for it. But we have discovered, Eli Lilly, all of these drug companies have discovered how they can continually bring in, if they had actual health care, we would not be rich. We would not be bathing in money because healthcare treats it at the root. Healthcare teaches the truth about what you put in your body, about the sugar, about the ultra processed food, about the seed oils. We literally suck on motor oil every day in your ranch dressing. Motor oil is in there.
Yeah.
When you see canola oil, when you see vegetable oil, when you eat the when you digest the oils that you literally cannot squeeze out, like olive oil, the healthy fats, you are ingesting motor oil.
Yeah.
That's in your ranch dressing every day.
Yeah. And I've experienced this firsthand of going overseas and experiencing the
Yes.
delightful taste of food that is
Mhm.
fresh.
Mhm.
Orange juice actually tastes like oranges and, not just sugar. The things that they provide you
Mhm.
don't cause you to gain weight. It
Yep.
causes you to live a healthier lifestyle.
Yeah.
So I can understand why these percentages are so much lower,
Yeah.
and because you see there was what 40.3% of adults here in America, or no, that's
Yeah.
US,
Yeah.
and then global at 16%.
16. Yeah. I had to change my coaching when I think I did it when you went to Italy. I used to be like, "We're carbs are
I went
bad,"
to
you
Paris.
know? Uh, low carb is the only way to go, and
Mm,
we have our clients go over to Paris and Italy and those places, they come back and they've lost 5
yeah.
pounds, and they've
Yep.
eaten the bread, they've eaten all of those things.
Yep.
It is unbelievable.
Yes.
We have given our health, we've given our destiny to these physicians and big pharma who is treating the symptoms, and
But
they love it when
also,
you come in with more symptoms.
not only those 2, but you're looking at the food
Mhm.
pyramid there. Not the food
Yes.
pyramid, the people that are making your food and are making a lot of money the cheapest way possible,
Yes.
and they're forking it in
Yeah.
because they're not having to use the more expensive products. They're
Mhm.
using, sugar cane, not
Yes.
sugar cane, but corn syrup. That
Yeah.
is the cheapest syrup that you
Mhm.
could possibly put in your food. So, of course, we're
Yeah.
going to put the cheapest product in the foods that you're addicted to.
So we're giving our money to big pharma to
Yeah.
treat these symptoms that are caused by their products.
Yes.
If you look, I had a client send me a list of her medications the other day, and each of the medications caused the symptoms of the other medication. She was bound, literally bound by handcuffs by the medication she was on, and all of those medication caused weight gain. So she was coming to me to help lose weight. There's nothing I can do. When you
Right.
are on medications that cause weight gain, there's nothing. If your
Yeah.
thyroid is damaged and you are on medication that is causing weight gain, I am handcuffed. And so we've got the pharma making medicine, but you nailed it, Darcy, when you said the food companies.
Yeah.
It is
They're raking
cheaper
it
to
in.
put maltodextrin in food, and the government is allowed to call it sugar-free when it spikes your insulin more than table sugar, but it's cheaper to put that filler in your food.
Yeah.
So the companies make more money.
Imagine this, and I just had this vivid imagery of a cut, okay? So
Uh-huh.
if you imagine somebody getting like just a scrape. It's not even a deep cut,
Mhm.
but it's enough that it is stinging and it's bleeding a little bit. What if you had to put a Band-Aid on this cut for every little symptom that you had, and it was, you had several layers on top of this cut to prevent every single feeling like stinginess. Oh, let's put a Band-Aid on that.
Mhm.
Oh, we've got a little blood. Let's put a Band-Aid on it. Oh, it needs to be now preventing bacteria to get into that. So
Mhm.
let's put another Band-Aid
Another
on top of
Band-Aid.
that. So you are putting layers of Band-Aids for one tiny scratch that your body can be capable of healing itself.
Mhm. Yeah. Yeah.
Period. Like
Right.
your skin will heal itself when it has a scratch. It
Yeah.
knows what to do. But when you're preventing your body from being able to heal itself and you're just putting a layer after
Band-Aid.
layer after layer of a Band-Aid thinking that's going to heal it, cuz
Yeah.
usually when my kids get a scratch, they think that putting a Band-Aid on it's going to heal it. No, it's just preventing the blood from
The
coming
germ.
out and
Right.
spreading
Yeah.
everywhere or germs getting in it. Things like that. But your body
Yeah.
is capable of healing that scratch. It's created to do that.
Yeah. Bottom line is healthcare doesn't bring in money.
No.
Healthcare, sick care brings in money, healthcare does not. And so what our president is doing right now, what RFK is doing right now is he's stopping that. And let me tell you the hell he's raising right now. I last night, it's demonic. It is demonic to watch these women, and they're women. I haven't seen any men do this, but they're women who are freaking out right now because we may have uncovered the root of autism. We may have uncovered, and as a mother, I was telling you before the show today, as a mother, if somebody on the other political side of the aisle that I sit on said, we have uncovered something that may prevent your kids from getting sick, heck, I don't want to take Tylenol right now. If I find that there is any connection between me giving my child autism in the womb or after the child is born, I'm not touching it.
Mhm.
I fear in my own household right here, I fear that I have hurt my children because we have some issues here in this house. What if I cause that? I'm dealing with a lot of guilt right now. And I'm not going to stay there. I'm not going to stay there because I want women, I want moms to understand if they can prevent something from happening to their children, by gosh, I don't care what political system is. I'm not doing it.
I think the biggest importance to think about, though, and I'm just now thinking about this, the thing that pops to my head is you can say that, but if we need to focus more on the natural,
Yeah.
like it instead of, because they create shots, they create vaccines, they create medicine for this. So if
Mhm.
it's going against that, like if somebody on the other side talks about like, hey, we found this natural form of curing cancer. I'm
Mhm.
listening. I don't care who you are.
I
I'm
don't care.
listening.
I don't
That's
care
more
who.
so like because they're gonna come out with, oh, well, we've created these things, and you guys are telling your young moms, not to let your babies get vaccinated. Well, that's not natural. Like we're putting metals in their body. Like
Yeah.
that is
If
not
I
natural.
if I had a do-over in life, I would do it over just to be anti-vax at this point, and I was not anti-vax. I was not. I was an edge. I wanted to know all about it. Let me tell you, sister, literally, sister, I am anti-vax right now. I am. I I am so, at this point, if the president of the United States would say that breathing and oxygen would cure cancer, do you know how many people on the left would drop dead and stop breathing? I am so tired of why are we questioning the what ifs?
Mm.
Why are we questioning when we know we've got the statistics? Darcy and I just went through the statistics. That is not political. That is reality. That came from the CDC. We've got a problem in the United States, and by golly, we need to ask some questions. And
And
so thank God we have an administration who's asking questions.
when you see those stats and they're just climbing, that is exactly why we need to be asking ourselves, okay,
Mhm.
what's going on here?
What's
What
the
are we
problem?
doing different than what we were doing before? Why were
Yeah.
our parents not gaining this weight? Why were It's not about moderation. There was women back there binge eating
Oh,
the
heck
cakes that
yeah.
they ate back in the
Yes.
day, and they weren't gaining as much weight as we were,
Yeah.
or are.
Right.
But having conversations like Charlie Kirk was talking about, having
Yeah.
conversations about and being open-minded versus being a bully about, well,
Mhm.
we went to college for 8 years
Yeah.
and then some. We went to college and we studied this for 8 years.
Yeah.
So how dare you fight
Yeah.
me against
Who who
my
who did
opinion?
the saying, "How's it working for you?" Who said that? How's it working for you?
I don't know,
It's
but
not working very well. These
right.
statistics are showing us it's not working. So why in the world are we not asking questions?
So
And thank
step out of that sheep line and say, "Hey,
Thomas
why is this
Jefferson.
happening?" Oh,
Thomas Jefferson said, "Be bold enough," and this is I'm taking it out of my head, so go Google it yourself. "Question with boldness the very existence of God." That is powerful.
yeah.
I am starting to question. And I think Dr. Berry, and I don't know if it was Kim or if it was Dr. Berry who wrote this, but I think the beginning of this happened when we started separating medical school
Yeah.
into specialties.
Yeah.
Because when he's so right. When we only look, when we've got medicine that is only dedicated to the pinky finger here, I'm holding it up for the podcasters.
Yes.
We've got pinky specialties.
Yes.
Well, if you take that pinky away from the body and from the root cause, and we are dealing with diabetes,
Yeah.
well, let's talk about the feet. We have to cut feet off for people with diabetes because we've got foot specialists and we have taken the root away, where the root of our health is eating low carb, whole foods, God made foods, managing your stress and sleep, and monitoring your labs
Yeah.
early. Your
Yeah.
labs now are not the indication of what happened in the first place.
Right.
We got to take this to whole body,
Yeah.
whole health, integrative health.
It's like doctors trying to create a painting
Mhm.
that unifies itself, but they're only painting their specialty.
Exactly.
And so when you are just having a doctor that's so close to the canvas and painting what they think and what
Yeah,
their specialty is, you're probably gonna have a foot on top of the head, or
exactly.
vice versa. You have got to work as a unified group to be able to work in the whole body for the picture to look
Yeah.
like a picture,
We need
to make
a
it
chat
unified.
specialist to create that image of what you just said.
Or you could just have an artist that knows how to paint.
Get your
Right?
paints out, Darcy, because that was a beautiful picture of
Thank
what
you.
healthcare looks like in the
Yeah.
United States right now. It's
Yes.
exactly what healthcare looks like.
And when we are so focused on that, we're not gonna
No.
fix. We're not gonna
No.
fix anything. We're just
No.
gonna keep putting Band-Aids. "Oh, I made a
Yep.
mistake over here that may have affected the brain." It's just like I was reading about
Yeah.
the thyroid the other day, about when they started learning to take the thyroid out when
Mhm.
goiters were happening. And then they realized, oh, these people
Oh,
die a couple
shoot.
years later. Why are they dying? Because the thyroid is so important for the whole body.
Yes. Even the
And so,
appendix is important.
yes,
God put it in us for a reason.
yes. I
When you and I when when we build this company, the first certification that you and I are going to get, I haven't told you this yet, but the
oh,
first certification is I want the integrative medication. I want the integrative medicine specialty, because if we don't fix everything, we are just band-aiding it.
yeah.
And we want to encourage our listeners and the people that spend so much time listening to every word we say. We want you to begin to question with boldness. Now, as Charlie Kirk found, and this is no different in healthcare, he was very spiritual and he talked a lot about God. And I'm telling you right now, as a person of faith, Christians are now hunted. We are hunted and we are in danger. If you believe in Jesus Christ, the Bible said it's going to happen, but we're seeing it. A man was shot 12 days ago. A man was shot for his beliefs. It is not safer. So even if you're not a person of faith and you are like, hey, coaches, we know something's going on. I am telling you, RFK's life is in just as much danger as Charlie Kirk's. And the president, who went after Tylenol himself yesterday, it
Yeah.
is dangerous to speak of these things,
Yeah.
because when you speak of these things, you're dealing with finances and
Yeah.
you are dealing with something that is very, very dangerous. So just because you're not a person of faith, but you're like, hey, something's wrong in our healthcare system,
Yeah.
you need to get a spine and you need to get courage, because you are just as much as dangerous as Charlie Kirk is.
You are messing with people's bank accounts.
Exactly.
That's
And
crazy.
watching the craziness of these women yesterday drinking bottles of Tylenol, it's demonic.
I
It
wonder
is
how they feel
abs
today.
I
You
don't
feel
know if
like
they're
they're
feeling
pain-free?
I don't I don't know. But that's how, when you mess with this, you are messing in the dangerous world of
Yeah.
politics, and you've got to get a spine. I I pray for Dr. Barry every day, because he is willing to speak truth. People like, like the Metabolical. Who wrote Metabolical?
Lustig.
Those people are in danger because they're messing with the very thing that could heal America.
Mhm.
If people understood that it's more than losing weight, we are fixing metabolic, we're fixing disease.
Yeah.
That's dangerous. I'm not going to shy away from it. You have seen clients come off of their medication within 3 months.
Yes.
What if we did that all across the country? What if people looked at KM Health Coaching as more than a weight loss company, which we're dang good at helping clients lose weight. We are good at what we do. 90% of our clients who join our elite program, 90% of them walk away with 100 pounds off of their body
Mhm.
naturally with no medication. 90%. That's a big statistic. And these people are walking away free of obesity. But more than that, they're walking away with no diabetes. They're walking away with no PCOS. They're healing themselves.
And they also walk away with asking themselves, "Well, why did I get here in the first place?"
Why?
Yeah.
When you ask the question, why, you have found your healing.
Yep.
Period. Now, do things pop up? I mean, you're in the middle right now. You're in the middle of healing psoriasis,
Mhm.
and you are biohacking yourself, and you
Yeah.
are learning the root of why you have that. And I think you're finding breakthroughs.
I
When
am.
you told me about one yesterday, like,
Were you there? Yeah. I said it in group too, but I
I think,
had
yeah, yeah. Somehow I heard it. I was in group, but I was in the car and I was listening. But
yeah.
yeah, so we're not done finding things. Dr. Lustig is not done finding
Mm-mm.
things. Oh, Dr. Chris. What's his
Palmer.
last name? Palmer.
Yeah.
He is breaking the box when it comes to mental health.
Yes.
We live with mental health illness, and we don't have to. He is fixing and healing mental health with a ketogenic lifestyle. It's way more than weight.
And this is all like natural. It's letting food heal us, not
heal thyself. Who said that? Heal thyself. I don't know if I said it or if somebody else said it.
You're making it sound like God said that, but I don't think God said that.
Well, that's the King James version of you can heal your disease. Right?
Yeah.
You've got to get to a point where you question everything with boldness, even the existence of God. Thomas Jefferson.
Mhm.
When you get to that point, you think you're home free, but you're not, because you will have the gates of hell coming after you and the gates of pharma coming after you. Yeah. Wow.
So I'm trying to still form my thought because I was journaling today, and about my own desires and how everything, the phrase of YOLO, you only live once.
Yeah.
Keeps coming to mind.
Yeah.
I've heard it several times. People that don't feel like they need a change because they're enjoying life. So why would they decide to change? Why would they decide to give up the things that are delightful in their life? And it comes down to what I was thinking of, like, okay, well, what's the spider web or the domino effect of enjoying things while you're still alive? Because essentially, eventually, you're going to get to a point in your life, if you are living it up and you are having donuts and you are eating the standard American diet to your fullest capacity, and also on medication and taking weight loss shots to counter the donuts that you're eating.
Yeah.
You got to think on down the road of what's going to happen to your body and your mind when you are, nowadays it's younger and younger. When you are in your 50s, maybe you're in your 60s and your health starts to decline and you're having to take more and more medication because things that are happening to you are uncurable. That is what you reap what you sow.
Yeah.
I believe. So when you think about you only live once, why would you not turn that around and say, since I only live once, I want to have the most clarity, the most strength, the most, the things that my body is capable of doing to the fullest. Why would you not want that?
Right.
I look back at my younger days and I wish, if I could go back, I wish I could tell my younger self, girl, get yourself together. This is not going to fix you. This donut at the end of the day, after a stressful day of dealing with kids, it's not going to fix you. It's not going to give you the energy and the clarity that you want for the next day. So that's what I would tell my past self. I would say, get yourself together, girl. You can do this. But when you have the mindset of YOLO, you only live once, so you might as well just take the risks and eat whatever the heck you want or do whatever the heck you want. I think you are taking that to the extreme. I think you can live by that motto. When you only live once, so what can you do good in this world for other people, for
for
your
yourself,
kids, for yourself? What can you do to improve yourself?
Yeah. I'm going to take exactly what you said. You gave me a 5th grade version, which I like. I live. That's my majority conversation with ChatGPT is give me a 5th grade response. That's what I live. So yours was perfect. Now let's flip this into physics. Okay. For every action, there's an equal and opposite reaction. Okay. So let's turn this into health. For nutrition, your action, regular processed food, sugar, or seed oil intake, the reaction of that is insulin resistance, weight gain, inflammation, and energy crashes. For movement, the action, remember, for every action, there's an equal and opposite reaction. For movement, action, which is daily movement or resistance training, okay? The reaction is a stronger metabolism, better mood, improved insulin sensitivity. For sleep and stress, the action, the chronic lack of sleep or constant stress in your life, The reaction to that is high cortisol, fat storage, especially, guys, belly fat, call them beer bellies, and the tire around the middle, okay? And blood sugar spikes. For mindset choices, all of these things have to be fixed when you go through a health. The action with consistency with whole foods, hydration, and rest, the reaction to that is stable energy, natural appetite regulation, and long-term weight loss. So for every action, there's an equal and opposite reaction. Or as Darcy said, YOLO. You only live once. You got an action or response to that. Okay. So if you only live once and you're eating donuts, you're going to have an opposite reaction to that. Okay. Yeah. Health is not random. That's what we want you to take away from this podcast. It is a chain of cause and effect. Health is not random. Okay. For every daily action that you take, food choices, step counts, bedtime, it creates a reaction, an equal reaction in hormones, weight, and disease risk. So every action on your plate and your habits is writing your story tomorrow. You only live once? Yeah. My gosh, I want to live to the fullest. And a lot of our women are so kind. And this is just something that is in our 7 years as a health practice. This comes true. You'll see it in every one of your coaching sessions. But Monica, my kids needed me. But Monica, my church needed me. But Monica, you're choosing to live in a massive amount of stress. And the reaction of that is going to be kids living without a mother because you've had a heart attack. Kids living with an obese mother, as I was for my entire life. My kids didn't get to see me running around the playground. My kids didn't have a mother who cared. I wanted to be out there. I couldn't physically do it because I was fat. Can't say word fat anymore. I was fat. And my kids lost a mother. So who wins at the end of that? I wanted to say that I was doing everything for my kids. No, I wasn't. I was being selfish. I was doing it for me.
You were living in your emotions.
I was.
And when you live in your emotions, yeah, your people around you, the people that you love, are gonna they're gonna get the effects of that.
Yeah.
You know,
so another selfish.
Another thought that I had today, I was on the roll of thinking today. But I was comparing, when you have too much to drink, or it's kind of like that comparison, that brain that you bring up about the comparison with somebody that is consuming cocaine versus sugar. Like the reaction of the brain is no different, right? Like they're the same reaction. And the same if you think about, alcoholism, or even doing drugs, or just altering your mind with substances. That's more so what I want to say. There's no different from food. When you are altering your food choices with now I'm drawing a blank. Maybe I need to have some food myself. But when you are altering your food choices with processed foods and eating the seed oils and just the standard American diet in general, and then you're altering your state of mind because you can't have that clear mindset. You're not thinking clear. It's no different from somebody who is alcoholic, or somebody who is on drugs, or altering their mind in that way. You are altering your mind with the food choices that you are making every single day.
Yeah.
So it's no different.
Yeah.
But when you are making choices of healthier options, the normal human diet that should be consumed every single day, you have this mental clarity.
Yeah.
It's amazing what your mind can do.
Yeah.
When you don't have substances blocking your brain from working.
Yeah. And a lot of people listening to us, coach, excuse me, today are like, I know you're telling the truth. I know, because I'm living in hell. I'm living with a body who can't get out of bed. I remember trying to get out of bed, and I had to try 3 times before I could get out of bed because I had so much fat on my body. And we have listeners, and let me tell you, we hear you, we see you, and we feel you. We are not bringing shame in any sort of way. We are trying to wake you up to say, The world needs you.
Mhm.
God needs you. Some of you are living in spaces right now where you couldn't do a single thing for God. You are not living out your mission because you are so obese. You're worried about losing your foot because of diabetes. You're worried about PCOS taking over your life. And you're hearing us and you're frustrated because you're like, Coach, I have tried everything you've said. I've tried, but I am addicted to food. I'm addicted to sugar. How do you know you need a coach? When you've tried every diet in the book and you've failed.
Mhm.
That's how you need a coach. That's how you know you need to invest in your life because you've tried everything and it's failed. We don't believe in medication to get you out of it because medication fails. Because medication, remember the equal and opposite reaction? That is what is happening. You may be losing weight, but you're also putting your body in danger because you're killing yourself with the medication. And so a lot of you are like, I'm frustrated with this podcast today because I've tried everything and I know what you're saying is true, but it doesn't work for me, coach. It may work for all of your clients, but it doesn't work for me. Those are the people that we're speaking to today.
Mhm.
Those are the people who need help out of this pit. And I always laughed at myself. I remember sitting with a friend and she was like, "Oh, Monica, you could open a company. You could make a lot of money, and you could build a big business because of what you do. You're so good." And I laughed at her and I'm like, "You can find what we do on the internet for free.
Yeah.
Why would anybody need a coach?" And then I began to coach and I realized the depravity and the hopelessness of people who are addicted
Mhm.
and people who just don't know how to do it. And the people who know that they have a problem, but they don't understand what the root is and they can't get out of this pit. And I'm reminded of the story of the guy who fell in the pit and he had all of these people above the pit throwing books down, throwing, the librarian who threw a book, here's how you get out of this pit, and the physician who threw pills down at him, and all of these people throwing things down in the pit. And then the person who saved his life jumps in the pit with him and he's like, well, crap, you're down here with me now. How in the world are both of us going to get out of this mess? And the coach takes his hand and says, because I've been where you are and I know the steps that it takes to get out of this pit, and helps him out of the dirt and the grind. Frankly, that's why doctors don't do this, because they don't have time to walk in the pit with a patient. They have 15 minutes with you. They don't have time. They know, not one person, not one doctor ever told me, Monica, you're obese and here's how you get out of it. And this will reverse your blood pressure. This will reverse the fact that you need your stroke level and you're going to die. Not one time did she say, you can fix this with your diet. You know why she didn't do that? Because it takes time. That's why 50% of our clients who only meet with us once a month fail.
Hmm.
That's why 90% of the clients who meet with us weekly lose 100 pounds and reverse their disease, because it takes time and it takes a lot of hard work. We walk through divorces with people. We walk through deaths in the family with people. We walk through all of the yuck. And that's why coaching works. And that's why we are so passionate about fixing the root and finding out what is wrong with this client. What is going on? What do we need to change at home? That's why coaching works. That's why we do it. And it is hard work.
Yeah.
Hard
And
work.
essentially, when coaching those, we've seen it over the years. It comes down to you have to have your aha moment
Mhm. Yeah. Yep.
and your I'm gonna do it. Like we can't do it for you. We can help you and show you, but you essentially have to do it. And that is what doctors don't
Mhm.
have time to. They just know, oh, they're not going to do it anyway. So why even,
Mhm. Yep.
why are we doing the long
Yep.
cut here? They want to help you get through the shortcut
Yep.
where it is also feeding their pocketbook, you
Yep.
know?
Yep. They know. So again, we blame a lot of this on physicians, and yes, a lot of it falls on them because of money, but a lot of it falls on us because they
Yeah.
know. They know, for example, if they gave you a meal plan, they know you won't follow it because it takes a lot of hard work.
Yeah.
So a lot of it falls on our side as well. If you are hearing us today and you're like, I've tried everything, tried every single thing, and nothing has worked. I've failed every single diet. I have fallen off the wagon. Everything has failed for me. You are prime for coaching. You are in prime need of somebody to walk and hold your hand the entire way. If you have over 100 pounds to lose, it's going to take a year. We have probably the most successful, the most financially costly, but the most successful is when we can walk with you through a year. We have that program. It beats any price of any doctor. When I say $3,600, people like, oh, but they will spend $1,500 a month for a shot that doesn't work. And it's literally a month. They will spend that money because they don't want to do anything. But you invest $3,600 in your lifestyle, let me tell you, you're walking away healed. You're walking away with no medication needed. You're walking away with success if you do the things that we say. Yeah. So I'm encouraging you, don't take the shortcut. Stop taking the shortcuts. The shortcuts, if you multiplied, our cheapest program is the 50% fail is $150 a month. If you took that and it doesn't work because you don't have a coach walking with you the entire time, 50% it does. And we give you the secret on how to make that work if you're going to go that route. Imagine all of these little tiny, a lot. I mean, you look at these meal plans, you look at all of these things. Imagine they all fail and you spend 150 here, 150 there, 300 here, 300 there, and they all fail. Imagine if you just spent $3,600 once and you're done for life. You spend more by investing little tiny amounts in these little tiny pills, potions, and magical things. And that's not a problem to you. They all fail. It's not a problem to you. But $3,600 looks like, oh my gosh, you're robbing the bank, right? And it works for the life.
Right.
I imagine you put $10,000 into your magical pills, potions, and passions. I imagine it's triple the $3,600, right?
Oh, for sure. Easy. Yeah. Because we keep taking them.
Yeah, we've done it. Yeah. Oh my gosh. Can you imagine how much money we've spent on diet scams?
In the 2 years or a year or so that I was on one of those MLM, I spent a lot of money. It was a lot of money.
Yes.
And now I don't spend that much. I spend it on healthy food for my family.
Yeah.
Versus these supplements that don't work.
It don't work. Stop wasting your money, guys.
Yeah.
Start looking at healthcare as what it is supposed to be. Healthcare. What is the root of the problem? Why are you sick? Why are you obese? Why? Did you crash your metabolism? What is going on? And stop participating in the sick care. The sick care will kill you. It will. We're a little bit passionate about this. We say things that most health coaches do not. And we say it with intentionality and purpose. We could be very, very wealthy if we went the sick care route. In fact, now my healthcare practice can prescribe the shot. If I chose to take our company down this path, Darcy, you and I, we could do most of our podcasts from the beach.
What?
If we did that. Totally. I won't do it.
Never do it.
I want to see you free.
Yes.
I want to see you free from the sick care system. So I won't do it. So we do podcasts from our home office because of that. But it is my hope and it's my prayer that people will find their way out and that we are the last house on the block when it comes to weight loss. Mm-hmm. Bitten Johnson said that to me when I became certified for sugar addiction. She said, we are the last house on the block when it comes to treatment because we believe in abstinence. We are the last house on the block. So we wait for everything else to fail, and then we come and we pick you up and we walk you through healing. Darcy, do you have any last minute thoughts or feelings on this topic of today? By the way, first, before you say that, if this has helped you, if you're feeling like, oh my gosh, they know what they're doing. I am tired of living in this. Please share this with your family and friends. Some of you are really concerned about your family who's on the shot, and you should be. You should 100% be. My TikTok feed right now, every other video is, have you gone blind on the shot? Have you lost your vision? You could be in what is that lawyer term? You could qualify for this for $1 million because we're suing them. That is every other feed. Why do that? So some of you who have people on the shot should for sure be frightened.
Yeah.
But if you find this helpful, please give us feedback on our podcast. Please share this. Give this to your family and friends. Sometimes people need hard things said to their family members, but they're too afraid. I'm not afraid to tell you. Coach Darcy is not afraid. What are your last minute thoughts?
My last thoughts are you are only limited by what you're allowing yourself to do.
Okay.
So it was probably sounding a little bit better in my head, but more so, what I'm saying is you are the one that's limiting yourself by not asking the questions why. Not by wondering, why is the doctor not able to tell me what's wrong with me?
Yeah.
You know your body best. You know the way you feel best. So ask yourself why. Why is this? And if the doctor doesn't know, then there's got to be
fire them.
Yeah. There's somebody else out there that does know.
By the way, we'll get into this at some point, but Dr. Barry is one who really does a good job about talking about this. If you're going to fire your doctor, you have to do it in a certain way because doctors talk to each other. And there's a specific way that you need to fire your doctor in order to get continued care. But what we're finding now is the homeopathic doctors, the holistic doctors, they're so booked out. And it is so frustrating because it's very hard to get into them. You can change some of this on your own before you even need one of them. And like I said, we do have the capability. We have lab access. If you need labs, if your doctor will not prescribe you labs, you can do it. You can use LabCorp, you can use Quest, whatever is closest to you. Reach out to us. We will hook you up. We will have those labs sent to you. We will prescribe them. We are backed by a physician. That's how I am able to do that. We are backed by a physician that is able to prescribe these. So if you need that, please reach out to us. And what I say alongside those labs, you need to get the books that go with them. What are they supposed to be like? There's a workbook version of this. I have a thyroid medication book that say, okay, doctors only prescribe TSH, you need more than that. You need to know, are you converting your T3 to T4? Are you converting? Are you doing all this? You need the hidden numbers. Those labs in the optimal ranges are written about.
But then when you're asking about your thyroid, then ask yourself, okay, what am I missing that's causing my thyroid to collapse? What am I missing?
What am I doing?
What am I doing? Ask the whys. Ask yourself, and then ask other people that may know.
Right. Totally. All right, guys, we are here every Tuesday morning live, our podcast. Oh, Darcy has her first podcast that has come out this morning. Go over to our podcast, Beyond the Scale, Weight Loss and Wellness, and you'll hear Coach Darcy giving her favorite tools for weight loss this morning. That was a really cool. I got to upload that yesterday. It was very cool. Darcy and I are going to start to do our own podcasting, and then we're going to hopefully be able to come together once a month for a joint podcast as the weather allows. Today would be a perfect day to record a podcast. Oh, by the way, we are. That's great. So go over there, find us, give us a review, and share this live with people. We'll be here next Tuesday morning at 11 a.m. We were a little bit early this morning, but go see us, subscribe. Contact us, kmhealthcoaching.org. You'll find Coach Darcy's schedule. You'll find my schedule. Sign up for a free health health. We don't do any health exams, but we do health consults. Sign up for a free one with us. Get on our calendar. We love you guys. We love you enough to tell you the truth. And we wish every one of you the best health and a little bit of fighting spirit. See you next week.
Hey, it's Coach Monica here. Guess what? If you're fed up with feeling stuck in your battle with weight or food, I've got something just for you. Check out our free Facebook groups. Over at Food Addiction and Recovery, I'm over there waiting for you. We're going to walk this journey together. It's about getting real, sharing our stories, and lifting each other up. We're in this together every step of the way. And if you're curious about changing your life with keto, the Weight Loss Project is where you want to be. Coach Darcy is amazing. And together, we're not just talking about losing weight. We're talking about finding a happier, healthier you. So, what do you say? Are you ready to join us? The links are in the show notes below. And I'm telling you, this is more than an invite. It is the start of something great.